Audioscan OTC DTC test suite, which is a bit of a mouthful. So at its core, it's an industry-first dedicated test box test for this product category that offers objective measurement of the capabilities of over-the-counter or direct-to-consumer devices. And so we've designed it to, it's like two ways to provide a way to quickly and easily assess, first of all, the quality and safety of OTC devices relative to the FDA criteria for these products. And what I think is also quite interesting is it also allows clinicians to screen the audibility capabilities of these devices for adults with mild to moderate hearing loss, which is, again, the hearing range category these devices are intended for. Needless to say, when the FDA ruling came down authorizing OTC devices, there were a lot of questions out there regarding the impact of these types of products on clinical practice, and what, if anything, clinicians could do to, engage with this product category if they wanted to. So really, we designed the test suite to help address that need and those questions. So again, when we pull this software feature together, we look to that final FDA ruling from October 2022. So time flies, right? Mm-hmm. But basically, we were looking at the aspects of that ruling in a number of ways. So one was looking at the specified technical requirements for these types of products, again, and also not to mention the hearing loss range that they're intended for and the age of the client, being adults with mild to moderate hearing loss. And so on the technical side, as it was developed, we've provided in the software with this feature a couple different tabs or areas you can go into. So one of them being the ANSI CTA-2051 evaluation tab. And so this was developed based on the methodology specified in the ANSI CTA, or Consumer Technologies Association document, the 2051-2017, lots of numbers there. And then it also considers the ANSI S3.22-2014 standard. So that's the one most clinicians are, more familiar with, that would be used when you're, say, doing your ANSI checks of hearing instruments from traditional hearing aid manufacturers. And so these documents were incorporated within the FDA ruling to provide guidance around things like, how should the devices be measured? What are the types of signals that should be used? What are the transforms that should be applied? And importantly, when it comes to the safety and effectiveness, they've indicated there are some certain, say, pass-fail criteria on a number of electroacoustic measures. So, for example, maximum output, distortion, bandwidth, these types of things. And so we've incorporated those criteria, those components in the measurement to ensure that, should someone run a device, they can be sure whether there's a pass or fail relative to these safety and effectiveness criteria. Knowing that, again, typically, these types of devices aren't fitted necessarily with professional care. It's usually over the counter. And so that's, again, part of the reason why the FDA specified these certain criteria. The nice thing with our test, though, is that, when it's run, the clinician can now quickly and easily evaluate the performance of the OTC in the test box and see on the screen a pass and fail indication for each of these measures relative to that FDA ruling. So I think it really, at the end of the day, just simplifies the evaluation, and also opens up the ability, potentially in some clinics, for those who may be less familiar with electroacoustic measures, or depending on the regulations in a particular area, to have assistants or other staff run the tests to evaluate these types of products. Yeah, so we kind of envision the test suite, as you're kind of touching on, right, that it provide a number of potential opportunities for clinicians to engage in the product category. And so, for example, one way might be to figure out a way to evaluate what they may want to stock in their practice, should they decide to include OTCs as an option in their practice. I think, as we know with traditional hearing aids, not all devices are created equal, and I don't think there's any reason to believe, OTCs would be any different in that sense. So, again, by using this tool, the clinician can quickly, efficiently, easily determine whether the product they might be considering stocking is up to the spec, up to standards, meets the FDA ruling criteria. Another potential use might be to quickly gather information on a over-the-counter product that was, say, purchased elsewhere by a patient who's kind of walking in your door, to determine the capabilities of that device, and ultimately to determine, what you might want to do next, so to guide the treatment options going forward. So whether that's, an opportunity to talk about, another OTC product that you're carrying that may be more appropriate, based on the measurements that you've made with what they've walked in the door with, or perhaps speak to the benefits of a traditional hearing instrument and the associated professional care that comes with that. And then again, all of this could, of course, be marketed to the community, depending on the services and the products that a clinic wants to offer. So I know right now there's a number of clinics, for example, that are promoting the fact that they will have the ability to evaluate and service OTC devices for current or new patients. And so I kind of see this test suite as a way to, efficiently and easily engage in this device category.
So you mentioned patients coming in with OTC devices. So what type of OTC devices can the test suite verify?
Yeah, good question. So, the nice thing is that really all styles of OTC devices can be verified in the test box. For those who are familiar with our products, they know that we have various coupling options available for traditional devices, for custom products and RICs and behind the ear systems. And in the case of RICs and, say slim tube type products that might be part of the OTC offerings, we now have a trick adapter, or puttyless coupling is kind of another way to think of it. So at the end of the day, all of those can be evaluated. And the nice thing too is, with this tool, you can take advantage of our unique industry-only binaural test box. So you can measure two OTCs simultaneously as you can in the test box with traditional devices. And so that just makes the whole process a lot easier and more efficient. And the clinician simply in the tool just needs to go into the software. So for example, in the NCCTA tab that I mentioned earlier, and just indicate the device type that they're evaluating, so that the appropriate mathematical calculations and transforms specified in the standard are applied. There's also another aspect to the tool, which is kind of an audibility evaluation, where in that area, you can also then introduce the opportunity for simulated venting in your occluded test box measurements. And so this is an interesting and unique offering from Audioscan that in the past we've provided just in the speech map screen for simulated real ear measurements. And it's a correction factor that we've actually independently validated with research partners at Western University. And so now we've just simply carried over for the audibility evaluation this venting correction component.
So you touched on the audibility evaluation feature. So that's something that's also included in the test suite. So just tell us a little bit about that feature and what the benefits are for clinicians and patients.
Okay. Yeah, I think of this audibility evaluation feature or tab is more or less like a quick hearing aid audibility screener that lets the clinician quickly find out whether this DTC or OTC product has the capability of providing, appropriate, let's say, audibility for an adult patient with mild to moderate hearing loss, and where the appropriate aspect comes from referencing, say, the real or aided response targets that validated generic fitting formula might recommend for someone with mild to moderate hearing loss for soft, average, or loud inputs. And so, in essence, should the measured simulated real ear measurement in the test box, fall within what we show on the screen, a shaded output range for mild to moderate hearing loss that's at the input level in question, then that would suggest that this hearing aid at least has the capability of providing appropriate audibility at the current device settings. And then to build on that, the nice thing is that the feature also allows the clinician to choose from either now NL2 or DSL5 adult targets with either flat, mild to moderate, or sloping mild to moderate hearing losses. Because, in this workflow, it may be the case that we don't know the hearing loss of the patient, right? It's an over-the-counter product. They may not necessarily have had a hearing test at this point. And so you can use the results of this tool to at least see if they in fact did have a mild to moderate losses, or at least the opportunity to provide appropriate audibility.
Oh,
So
interesting.
overall, I'd say a great, counseling tool, learning tool regarding the capability of the product, and it can ultimately help guide, clinical decision making going forward.
Hmm. Yeah, giving some good idea of how it's functioning for sure, and possibly if a prescribed hearing aid is needed versus an OTC.
Exactly. I mean, we've kind of, in talking with some clinicians, they've said, well, it may also be an opportunity to kind of speak to, should you have this type of hearing loss, this product may or may not be appropriate. And then, well, let's now determine what your hearing loss actually is so we can have a better understanding of what's, appropriate for you, and then move through the workflow to the hearing test. There's an opportunity to kind of keep things moving forward. So there's flexibility there, right? It's kind of, and that's a tool again that the clinician can choose to use as they see fit.